19 out of 20 pregnancy-related deaths were preventable in Iowa from 2019 to 2021. That's according to a recent report from the Iowa Maternal Mortality Review Committee. As KCRG TV 9's Emily Schrod shows us, the reason behind why they were preventable isn't simple.
The Iowa Maternal Mortality Review Committee released its report for the maternal deaths from 2019 to 2021, showing almost all pregnancy-related deaths in Iowa from that time were preventable. But chair of the committee, Stephanie Radke, says while that statistic is staggering,
I think is important for the public to know is that 95% preventability does not mean that all of these people could have lived if they hadn't gotten better health care or something like that.
Radke says there can be multiple factors in why these deaths occurred.
Somewhere in our system, in our state, we could have maybe done better with community resources, with social work, with care coordination, or potentially with improved quality of health care.
Radke says infections were the leading cause of pregnancy-related deaths identified from this time period. She says it's important to note the majority of those deaths were also related to COVID-19.
We expect that we will see fewer deaths in the next time period, assuming we don't have another global pandemic.
Some hospitals are working to improve obstetrical care for Iowans, like Mercy One's helicopter maternal transport team that launched back in October.
They provide the same level of care that they would receive in the facility by these nurses, and we take that to the mother so that we can provide the highest level of care that we possibly can to get them to the highest level facility.
Radke says the report does help show there are some areas where changes can be made.
We need to make sure that our systems, our healthcare systems have up-to-date policies, staff education, protocols, simulations, so that everybody's prepared to manage a pregnancy emergency in a good way.
Emily Schrod, KCRG TV 9 News.